Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk a little bit about one of the struggles that I think a lot of us go through. And it just came to a point yesterday. So I don't know about you, but I have some block time at the hospital. It's usually on the third Wednesday of the month. And then we have another time, we have the first and third Wednesdays. And there's a couple of places we have for surgery locally. One is a local teaching hospital, which we have residents we work with. The other one is there's a residency at that one. There's another bigger hospital that we work with the residents, but they kind of cover that second. And then there's a third place, which is a surgery center, where they cover it even less. And so the problem isn't so much having residents. It's nice to have residents. They don't usually, they help a little bit, but the cases I do, which is typical bread and butter podiatry stuff, it's not really necessary. And so what happened the other day is I had a case scheduled at 8, and then I got to, the hospital, and they bumped it to 10, and then they bumped it to 12:30. And, I learned a while back that I don't usually schedule cases or patients after cases because it used to cause me too much stress. But I start to like less and less surgery as I've been practicing longer and longer because of the stresses that go with it, both post-surgically and just the stresses of the scheduling and things like that. So I learned a neat concept when I was talking to someone recently, Mitch, and he recommended, this is what they did, and I'm just throwing it out here because I think it might be a good idea, is he does surgery, I think in the morning at a surgery center. So they actually start at a 7 a.m. start time so they can get one surgery done and then go see patients in the office. So when you have an early start time, you can kind of guarantee when you're going to be back in your office. So I thought that was a good way of doing it. I used to do it like half day, and then I would go back to the office after about noon, but then it always got kind of bumped, and I the turnover time took a long time. So the surgery center is a nice idea because they're usually quicker turnover. You can kind of guarantee when you're going to be back in the office. The other option is this whole MIS that everyone's kind of talking about, doing MIS in the office, which tends to pay a little bit better. That might be another option for you as well. So the other big tip I have for surgery, this is something that's helped me. I don't know if it's helped you guys, but I have actually started a list of things, of surgical procedures that I really feel confident and like doing and I'm good at. And then the other ones that I'm not, I just don't do those. So I have this list, and I check my list, and it has all the kind of what I need for the surgical case. And if it's not on my list and I don't feel really comfortable, I refer it to one of my partners or one of the colleagues in the office that does a lot more of these other bigger procedures that I just don't do. So that's another kind of a surgical tip for me. And frankly, it was really humbling in the beginning, and it was hard on my ego. I was like, I should be able to do and be doing all these things, these big cases, and all of my headaches came from me just not having a residency that I learned and did a ton of them. I watched a lot of them, but I didn't feel comfortable doing. Now, some of you listening to this are probably a lot younger than I am and just got out and you're comfortable and you like doing all these, and that's fine. You can do it. Have your time. I just find that the surgery at the hospital tends to be very inefficient. The surgery center is much more efficient and much more fun and a lot quicker turnover and things like that. But at the hospital, where I'm at anyway, you're lucky if you can get like 3 cases in a whole day, unless they're giving you 2 rooms just because of the turnover time. Anyway, I'd like to know what you guys think of this, and once again, have a great day.